Students, today I'm going to be going through your therapeutic and physical modalities, which will be in your packet that I handed out while you were in class last week. And turn to the third page, and it will be titled with the same title. And you have front and back of 2 pages, so you have 4 pages of notes that you will take as I go through this lecture. It should take about 15 minutes to go through it, so please hang with me. And a lot of this information will be on our test, which will be next week in class. All right, so what are modalities? What are we talking about here? Therapeutic physical modalities are anything that an athletic trainer uses to treat an injury. So hot, cold, ultrasound, it could be electrical stimulation, it could be elevation, anything that's used to decrease pain, reduce swelling, things that promote healing are all modalities. So definition, modalities are methods of treating injuries. Athletic trainers decide when it is needed and when it is not needed, and which modality is the correct one to be used and when. So when do athletic trainers, when do we use heat? When do we use ice? So we'll talk about those couple of things first. When you use compression, when you use elevation. The first thing that we're going to talk about is cryotherapy. Cold packs, this would be a bucket. Cold buckets or ice bath, ice massage are all used in the management of pain and edema. Edema is just generalized swelling. They are also effective in decreasing muscle guarding and spasm. The term effusion, remember we talked about in class, is used only on a specific joint. When the joint capsule has swelling inside that joint capsule, it's called effusion. The body's reaction to cryotherapy include initial vasoconstriction. So the blood vessels that are going to that part of the body that's where the injury has happened, whenever we provide ice, it constricts or gets smaller. And we'll have a picture of that a little bit later on. Cold is a modality or the method of choice for an acute injury. An acute injury is something that just happened. So an athlete is on the soccer field, they twisted their ankle, and the athletic trainer has them over on the sideline. That's an acute injury. And should be applied as soon as possible for a maximum of 20 minutes. With icing, we often recommend 20 minutes on and then 2 hours off. 20 minutes on of icing and then 2 hours off. You want to go through this cycle 3 to 4 times a day in the initial phases, the acute phase of an injury. Now we're going to talk about the different types of cryotherapy. The first one is an ice pack. An ice pack is easy, it's economic. It's easy to send an athlete away with an ice pack. It's important to elevate the extremity as well, especially in that acute phase. If you can keep that injured body part above the heart to keep the swelling going back and pumping back through the body and not pooling down in the limb. It's easy also to secure. You can see we use the flexi wrap to secure ice bags on athletes, and then they can go on home and start studying, get their dinner, whatever they have to do in the evening after the practices. There are some people that have a rash appears if you put ice directly on their skin. It looks like this right here. I know when my daughter was little and we would put her in her snowsuit and she would go out and play in the snow, sometimes her gloves would come up and then she'd have this ring, and it looked just like this of where the snow had gotten in her gloves and she had a rash, or she's kind of allergic to that cold or that ice. Some people have that. What to do, just put a towel, a cloth, a paper towel, anything that you may have that would put that between the skin and the ice pack. So ice pack, once again, very economical, it's easy, it's quick for the athletic trainer to use. The next one is ice massage. The big benefit of ice massage is that the treatment time is shorter. The treatment time for an ice massage is about 5 minutes. Another benefit is that the athletic trainer, we can freeze these and give them to an athlete, and they can do this on their own. They can say they had shin splints, they can massage the shin on their own with the ice. It's used for localized problems. Tennis elbow, the elbow would be another good location that you could, as you can see in the picture here, that you would use ice massage. They sell these cryo cups where it's perforated and you just kind of tear off the bottom, and then you use that as the cone that you rub on the injured part. Here at North, Mr. Snow just puts styrofoam cups in the freezer, fills them with water, then he has a big ice chunk, and then you just peel off the top, the styrofoam. And that's going to look like more like this. So used for localized problems, ice massage, the athlete is going to briskly or quickly rub the ice along the injured area. Treatment time is very short. It's only about 5 minutes as opposed to an ice pack being 20 minutes. And it's economical because you can use styrofoam cups. Cold water and compression. So the Game Ready, I know we've talked about this and how it's such an essential piece of the training room at North. But the Game Ready combines cold water, ice cold water, and compression. You can also elevate, so you're getting multiple modalities at one time. So you're getting the compressing the area to press the swelling out. You get the elevation to get the swelling moving back away from the limb, because we don't like swelling. Swelling, it's uncomfortable, it hurts, it makes our joints stiff. So we want to get that swelling out. And then the cold also with the vasoconstriction. You have different sleeves you can see in the picture here. This gentleman has a shoulder sleeve on. There's a knee sleeve. There is an ankle sleeve that goes along with these. But Game Ready that is cold water. So it's cold compression, and then you can add elevation to that as well. Treatment time is 15 to 20 minutes, so it could be slightly shorter. Only thing with the Game Ready, you're not going to send the athlete away. The athlete is going to stay in your training room there to complete this session. So a little bit more time intensive. Ice bucket or ice bath. The main benefit of an ice bucket or an ice bath, if you have an irregularly shaped injury, so say you have an athlete, a football player, got his hand crushed between two helmets, to put an ice pack on the hand, you can, and that would work. But you have all of these little indentions and protrusions here along your hand. You're not going to be able to completely cover the hand. So if you get a small bucket for a hand, fill it with ice water, and then submerge the hand down in the bucket and keep it there for 10 or 15 minutes. That is going to be probably the best thing that you can do. An ankle is another one that, it's bony, a lot of irregularly shaped bones there. If you can put your foot in an ice bucket like this person is doing here, that will be beneficial. Treatment time is 10 to 15 minutes. The temperature should be about 55 degrees. Other things with this, I guess it's not real comfortable at first. You have that, the C-band is the acronym that we'll talk about later, but it feels really cold at first, and then burning, and then achy, and then numb are the feelings that you go through. So once you get to numb, if you can make it to numb, then you're golden, but it does hurt and burn for a little bit. So an ice bucket or ice bath benefit is going to be that it's going to hit all of parts of a hand or an ankle. That would be good for fingers as well. All right, so we're moving to heating agents now. The benefits of heating agents, that's vasodilation, so it's dilating or bringing blood to the area to help move out the injured and bring activity to that area. So benefits: reduce pain, promotes blood flow and healing, it increases range of motion, and can also increase muscle relaxation. The body's response includes increased vasodilation, increased metabolism, capillary pressure and flow, and oxygenation of tissue due to more blood flow. We want to get that moving out. We want to get that area healed. We talk about in class, we use a hydroculator pack. I may have that on the next slide. I can't remember. But here there's like a home heating pad that you probably all have at your house. This is going to be dry heat, so it's okay. But the hydroculator pack is moist heat that we have in the training room. And that's going to be better. It's going to be a deeper heat. Big idea from the first few slides: ice in acute injury to decrease blood flow and therefore prevent swelling and inflammation. This is going to be vasoconstriction. You can see right here the vasoconstriction. The blood vessels are constricting and pushing the blood away from that area, so it's not pooling and causing stiffness and swelling. At the latter stages, after our first 48 to 72 hours, we may use heat for vasodilation. We're going to bring oxygenated blood to that area to help promote healing. Oh, here's the hydroculator. You can see you have to have the hydroculator pad. Here's the hot part that goes in from the canister. This is superficial heating. It's easy to use. The athlete does stay in the training room for this. You have the tongs because it is such hot water that it is in. Treatment time is 10 to 20 minutes. Care must be taken to avoid burns. Once again, you don't want to use heat in an acute injury. We don't want to bring extra blood to that area. Hydrotherapy. Well, if you break down much of what we do here in sports medicine, if you break down the root words, you can figure out what we're talking about. So it will be very helpful on your test. But hydrotherapy is the next thing we're going to talk about. Hydro is water, so this is water therapy. We're going to talk about the whirlpool here. It's a form of superficial heating that uses agitated or heated water. Much like if you have a hot tub at your house, 105 degrees is preferential for this hydrotherapy. We have whirlpools, and we talked about when you guys made your training room budgets at the beginning of this semester. Many of you, I think all of you, had a whirlpool or two, a large and small, in your training facility. But these are stainless steel or fiberglass tubs that have a turbine attached to it that moves water. There's water flow. This is used for large areas that may have injuries. Rehabilitation exercises can be done during this hydrotherapy. So all kinds of water exercises in the rehabilitation realm of things. Physical therapy is done with hydrotherapy at times. Disadvantage would be the time it includes to fill the whirlpool, disinfecting the whirlpool, and then also the inability to be able to evaluate the injured site during treatment. Treatment time is 10 to 20 minutes. That is hydrotherapy. The next one's contrast therapy, which I have seen used. It's not as common, but contrast therapy is where we're going to use hot and cold. And the concept or the theory behind it is that it kind of acts as a pump to push the blood out of that area. So we're going to use cold for vasoconstriction to push out, and then we're going to open up and bring new blood into that area that's oxygenated to hopefully help with healing. Use the alternative hot and cold water baths for ankle, foot, hand, or elbow. It's used in the subacute stages, so this is not something that they're going to do right away. This would be something that is done later on, at least 3 days after an injury has occurred. This helps reduce swelling and pain. It can increase range of motion by getting that swelling out of the joint. But once again, not real often used. I always think of when I was a kid and we went to hotels, we would always jump from the pool. It was probably, I don't know, it always felt really cold. Then we'd go into the hot tub, and then you go back into the pool. With that contrast, that difference is very similar to this contrast therapy. 105 in a whirlpool feels great until you jump into a cold bath that's 55 degrees. There's a stark contrast there that is pretty uncomfortable at first. So that is contrast therapy, hot and cold, and creating a pump to pump blood out. Ultrasound is the next one. Ultrasound is very high frequency sound waves, which creates heat. It's a deep heat, absorbed by tissues high in protein such as muscle, tendons, ligaments, and joint capsules. Sound waves are transformed into deep heat within the targeted tissue. I think the next slide, with athletic trainers, they have some choices on how deep that sound wave goes, depending on what your injury is. There must be a coupling agent, so the ultrasound gel has to be used with the ultrasound, or you could burn your athlete. Also, the ultrasound has to continuously be moving, and you can only do a fairly small area depending on the size of the head of the ultrasound. But it's not going to be for a huge area. You're not just going to be going all over the quadricep up and down. It would be kind of a general smaller area. I think we have more on that here. Ultrasound is used to facilitate tissue repair. You can see in this picture here, the 1 megahertz and the 3.3 megahertz, those are settings that the athletic trainer may use. This is what our ultrasound machine looks like here at North. The stem is also part of this machine that we have. I think Mr. Snow has ours off of the stand now. It's sitting on the counter. Ultrasonic beam is created by vibrating synthetic crystal found in the sound head. We talked about that crystal. The sound beam can be produced either as a continuous or a pulse mode, so the athletic trainer has control of that depending on what the injury is. Treatment size can be only 2 to 3 times the size of the ultrasound head. Treatment time is 5 to 10 minutes. Something we always talk about here is because it is sound waves, so it's creating that vibration. If you ever have a broken bone, you definitely do not want to use ultrasound because that vibration of the broken bone would be extremely painful for the athlete. Mr. Snow talked about the tuning fork in class as an example. I talked about when I was in high school and my finger was broken by my volleyball coach and the athletic trainer tapped on the end of it. You don't want this. Ultrasound, I think this is the last one. Treatment should not be used over fluid-filled cavities, eyes, heart, bone growth plates, fracture sites, artificial joints and herniated disc. Mr. Snow used an example of an athlete when he was at William Jewell that he was wanting to have ultrasound done on his left pec that he had strained. And with the heart being right there, that was not something that Mr. Snow was willing to do as a head athletic trainer at Jewell. And I believe the athlete understood after they talked about that why that would not be good. Shouldn't be used in the acute stage of an injury. E-stim or electrical stimulation is the next one. The use of E-stim, electrical impulses, produces muscle contractions by stimulating the motor nerves. So you have a voluntary contraction. If you extend your leg, you are telling your leg to do that. You're voluntarily doing that. With E-stim, you put these patches on the muscle, and then they turn the machine up, which sends a little electrical impulse and fires the muscle for the athlete. This can be used in the, initial stages after some type of a surgery. Say it's a knee surgery on the quad there. You can see the guy with the E-stim on his quad. But it's just firing the muscle without the athlete. It's not a voluntary, it's an electrical impulse. E-stim used to be very, very popular when I played soccer in college at Northwest. I had a lot of friends. I was very fortunate not to be injured then, but E-stim was used very, very commonly. I think every athlete that went in for whatever injury they had in the early 2000s, they got E-stim of some sort. There are different ways that you can do this. One of the most common is the Russian electrical stimulation, so I'll talk about that in just a minute when we do the NMES. Proven effective in increasing range of motion, muscle strength, reduction of muscle re-education of muscle after surgery, and I'm going to talk about that in a minute. Improving muscle tone, enhancing function, controlling pain, and reducing muscle spasm. I believe the controlling pain is, I don't know that has been as strongly proven as the others in more recent research. The next thing we're talking about is neuromuscular electrical stimulation. So this is the re-educating of the muscle. So after somebody goes through a surgery, something happens in just minutes or days after the surgery where the muscle, it kind of starts, it stops working. It sometimes won't fire after a surgery. If you have a knee surgery, sometimes the quad, you aren't able to get it fired. So by using this neuromuscular electrical stimulation or E-stim, they can artificially fire that muscle, and then the athlete would do a contraction like a quad set, like we did the other day in class, for example, do a quad set while the E-stim machine is firing the quad. So you're retraining the brain how to fire that quad after a surgery or a time of immobilization where you're not able to use that muscle. NMES is the most common type of E-stim, which stimulates a peripheral nerve to cause either a sensory or motor response. Functional E-stim is used to improve muscle function. This would be where the athlete is doing an exercise at the same time, some type of an isometric contraction at the same time that the E-stim machine is firing the muscle. The next one is the TENS machine, or the transcutaneous electrical nerve stimulator. It's a portable unit that somebody would wear throughout or for an extended period of time. They can go about their normal activities while using this machine, which is different than the E-stim you'd hooked up to for 10 or 15 minutes. Once again, E-stim should not be used over sinus cavities during pregnancy, an individual with a pacemaker, because it is electrical stimulation on people who are sensitive to electricity, or any time active motion is not allowed, because this will make the joint fire. All right, it looks like, let me make sure we got through all of our notes here. And it looks like we did. You have these 4 pages, front and back of 2. I should have gone through and answered all of those questions for you. We will hope to see you in class soon. Have a good day.